Good afternoon, and thanks for joining us. My name is Ramona Nowak, and we're going to talk about managing type 2 diabetes today. Welcome. When a person has type 2 diabetes, either the body does not produce enough insulin or the insulin that is produced is not used properly. Insulin is produced by the pancreas in the body. It's actually located right behind the stomach, and the pancreas is part of the endocrine system. The exact cause of type 2 diabetes is not known. Several risk factors have been associated with it, though. Risk factors for type 2 diabetes include physical inactivity, being overweight or obese, history of gestational diabetes, genetics, family history, age, race, and ethnicity. Type 2 diabetes can be treated with lifestyle changes, oral and/or injectable medications, and/or insulin. Your doctor may refer you to an endocrinologist to help you manage your diabetes. An endocrinologist is a medical doctor that has had extensive training in understanding, diagnosing, and treating conditions related to the endocrine system, and this would include diabetes. Know your A1C level. Your A1C level is your average blood glucose level over the last 3 months. An A1C level is obtained with a blood test. There are health benefits to controlling your blood glucose level with an A1C level at a goal set by your healthcare provider. What's important about the A1C level is that every 1% decrease in an A1C level reduces the incidence of kidney, eye, and nerve problems by 33%. Control your blood glucose level and maintain healthy cholesterol and blood pressure level. This will lower your chance of having a heart attack or a stroke. So make sure that you know your A1C level and goal. Have your eyes, feet, and kidney function checked once a year. Type 2 diabetes management involves several factors: increasing activity and/or exercise, making dietary changes to help manage the blood glucose level, taking medication and/or insulin as prescribed by your healthcare provider. Another aspect of treatment involves monitoring of blood glucose levels. This helps your healthcare provider to make decisions about your treatment plan. Blood glucose monitoring. Your doctor can prescribe a glucometer that uses a drop of blood from your fingertip and is placed on a test strip to obtain the blood glucose level. The glucometer can store usually up to 500 blood glucose levels in each device, and there's no way to erase the memory on it. It's important to set the correct date and time on your glucometer so that accurate information is recorded. Continuous glucose monitors, or CGMs. This is a device that measures your blood glucose level continuously throughout the day. CGM devices are prescribed by your healthcare provider and have certain requirements established by Medicare guidelines to obtain the device. The requirements are usually blood glucose testing 4 times per day for a month and to be on 3 insulin injections per day. Increasing activity and/or exercise. Being active helps your body become more sensitive to insulin. The current recommendation for activity and/or exercise is 150 minutes per week. That's 20 to 25 minutes a day. If you're just starting out, find something that you like to do. This helps ensure that you will continue with it. There's a website called www.youtube.com that has armchair exercises if you have difficulty with ambulation. This is extremely helpful if you have to do exercises and are unable to stand. So check out different ones and find out what's going to work for you. For activity, start small and work up to your goal. For example, parking your car further away from a store can increase your daily steps. Walking the dog further than normal helps with this too. Find a partner if possible. This can help to motivate you to continue with your increased activity. Schedule your activity time in your daily routine. Be sure to check your blood glucose level before your activity or exercise session, especially if you take insulin. Exercise can cause a low blood glucose level to occur. This is less than 70 milligrams per deciliter. In general, if your blood glucose level is below 100 milligrams per deciliter, have a small snack before any activity or exercise. Carry glucose tablets and a snack so you're prepared in case your blood glucose level does lower while you're away from home. Medication management. Your healthcare provider will prescribe your medication and/or insulin as needed. Medications act on different parts of the body to help control blood glucose levels. Discuss possible side effects with your healthcare provider. Medications that help to control blood glucose level help you to lose weight and have a beneficial effect on the heart and kidneys are all options for a prescribed medication. A combination of medication and/or insulin are usually required to help manage blood glucose levels. Being on insulin can potentially cause hypoglycemia or a low blood glucose level less than 70 milligrams per deciliter. Treatment involves ingesting 15 grams of a quick-acting carbohydrate, like 1/2 cup of juice or 4 glucose tablets. It's important to have a snack as well. Symptoms of a low blood glucose level include sweating, feeling shaky, having a headache, feeling tired, or confusion. Some people may get all of these symptoms, some may get just one or two symptoms. With insulin, there are different brand names and generic names of insulin. They are classified as long-acting, intermediate-acting, or rapid-acting. This means how fast they start working, if they have a peak time where they work the hardest, and how long they last for. Your healthcare provider can help you to develop a plan special for you to help control your blood glucose level. It's important to have regular checkups and foot exams, as well as yearly eye exams and blood and urine tests. Talk with your provider about what your blood pressure is and your blood pressure goal, what it is, as well as your cholesterol level and cholesterol goal. In conclusion, type 2 diabetes is a manageable disease. Having a plan in place is important to help keep you healthy. Thank you, and now we're going to focus on dietary changes.
Hello, my name is Elizabeth Sujek, and I'm a dietitian diabetes educator here at the Diabetes Endocrinology Center. And today I'm going to focus on meal planning. Now, meal planning is a key part of diabetes management, so a role of a dietitian is very important. And my role as a dietitian, diabetes educator, is to treat diabetes with what we call medical nutrition therapy. Now, many insurance plans will cover these services. However, it's very important that you check with your insurance provider for coverage. It's really important to make sure you ask questions about diabetes education when you talk with your insurance company. Now, meal planning approaches. There's actually no ideal meal plan that will work for everyone. It's important to understand that each person's diabetes treatment plan is developed to work with that person's individual needs. So your diabetes needs and meal planning needs is going to be different from another person. So that's why it's important to get that opportunity to speak with a dietitian. Now, today, what I'm going to do, I'm going to focus on two basic meal planning guidelines. Actually, there's a lot of different approaches, but we're just going to look at two for today. Now, the different types of meal planning, it includes carbohydrate counting. Now, carbohydrate counting is something that we're going to touch upon later. And what it does is basically looks on a consistent amount of carbohydrate at each meal. Carbohydrate counting definitely works with individuals who are taking multiple daily injections. We can simplify a person's meal planning, basically focusing on healthy food items. Create your plate is another type of meal plan that we're going to talk about today. We call this the plate method. Now, the appropriate method is determined based on individual needs, cultural, learning level, and financial needs. So you have to be mindful not to worry that if you are struggling, we can definitely find a meal plan that will work best for you. And that is the role of a dietitian, is to work with you specifically so we can focus on your needs. Okay. Now, eating healthy does not have to be boring. You do not have to become a rabbit eating person. You can have fruits and vegetables and whole grains. There are different things that you can incorporate into your eating pattern. But one way to feel your best and improve your blood sugars will start with the food items that you choose. And once again, there is no magic diet for diabetes. So we're going to look at two different types of meal planning methods. And the first one I want to focus on the diabetes plate method. Now, this method can help you create a balanced meal of vegetables, protein, and healthy carbohydrates without counting. All you need is a plate. I'm going to try and show you a picture, so hopefully you can kind of see this in the camera because it's rather big. So, do we have that? Yeah, okay. Trying to see if I can show that to you. So, how do we create a healthy plate? Well, the American Diabetes Association Create Your Plate shows how you can manage portion sizes and eat balanced meals. Now, for example, you want to visualize an imaginary line down the middle of your plate. Then use an imaginary line to equally divide one of the halves into two sections. First thing you want to do is place non-starchy vegetables. Now, non-starchy vegetables can include things like broccoli, salad greens, tomatoes, green beans, carrots. So there's a lot of different types of vegetables that you can focus on half your plate. Next, you want to put your starchy food items, such as a small amount of pasta, for example, a small potato, if you choose rice. That is going to fit into the smaller section. Now, what you would do is place your meat in the other small section. And it could be chicken, turkey, fish. Make sure it's lean. We'll talk a little bit more about that, but that will go in the smaller section. You may also include a small piece of fruit or even a glass of milk to balance out the meal. Now, what we're going to do is briefly touch upon carbohydrate counting. But before we do review it, it's important to understand why we need to focus on this food group. Now, there are three types of carbohydrates, or we can define a carbohydrate as starches, sugar, and fiber. Now, what the job of a carbohydrate is to do, basically your body breaks down the carbohydrates into glucose or blood sugar, and your body will use that glucose for fuel. When we talk about multiple daily injections, that pre-meal insulin that a lot of people with diabetes take works on that carbohydrate portion of their meal. Now, to help establish a consistent pattern of blood sugars throughout the day, it's important to eat a consistent amount of carbohydrate at each meal. A dietitian will help determine the number of carbohydrates that is needed, and once again, this is based on individual needs. Example of carbohydrate food items. When we look at non-starchy vegetables, and I mentioned this at the plate method, the broccoli, greens, and green beans, and tomatoes. Now, these items have a lot of fiber and a lot of nutrients. They have little impact on your blood sugar, and this is why you can fill up half your plate with them. Also, you really do not need to count them as part of the carbohydrate portion of your meal. Fresh fruit. Fruit does have natural sugar. However, fruit is a healthy addition to any meal. And we have to keep in mind that when we look at fruit, yes, it does have natural sugar. It's not going to have the same impact on your blood sugar as a piece of cake. So really, we don't look at them as being the same. You can choose the fresh fruit or canned fruit that is packed in water. Non-fat milk and yogurt. Once again, these are healthy carb additions to any meal. Milk is a great source of calcium, vitamin D, protein, same thing with yogurt. So we do want to make an effort to incorporate them into our pattern of eating. Whole grain starchy foods, such as brown rice, even whole wheat bread, your winter based squashes like your butternut squashes, your acorn squashes, sweet potatoes. Now, these items are actually popular this time of year. So, once again, we can definitely incorporate them in as a healthy carbohydrate food choice. Also, to your kidney beans and black beans, these are also very good and healthy for you as well. They have a lot of great source of fiber, and also too, they're considered a plant-based protein. So as I said, these items are high in fiber and they will have a lesser impact on your blood sugar compared to processed items. Things with added sugars such as sweetened beverages, cakes, candies, pastries. So these are the food items that we want to choose less often. But you can incorporate them in, but it's important that we do pay attention to how much we consume. Protein and fats. Well, protein and fats are our body's other fuel sources. These items do not directly impact blood sugar and are needed by the body. However, it is important to understand that if you give your body more protein, more fat than it needs, this can lead to health problems. Once again, a dietitian can help determine what your protein and fat needs are. When it comes to protein, we want to choose lean protein, such as poultry, fish. You can even incorporate eggs as a healthy protein source. But once again, it's going to be that portion control. Okay, that is always going to be the key. We want to limit fatty cuts of meat, skin on poultry, fried meats, and high fat cheeses. Once again, the amount that we consume is important. Consulting with a dietitian will help determine how much protein and how much fat your body does require because once again, there's not a standard one size fits all meal plan. Fat is your body's most concentrated source of fuel. And once again, portion control is very important. We recommend fat sources that come from plant-based items such as like nuts, avocado, olive oil. Now these are just a few examples. Once again, portion control is going to be the key. Now, today's presentation only covered the basics of meal planning. So honestly, meeting with a dietitian, a diabetes educator will help determine what you need to manage your diabetes. It's also important that you communicate with us what's going to work best for you. Thank you very much. Okay, hold on one second. Okay. When it comes to the foods that are not recommended to eat, we really want to focus on, and as I said, carbohydrates that are really, we call unhealthy carb items, such as cakes and pies and sweets and desserts. These are items that really give you no nutritional benefit whatsoever. So yes, we want to back off on those items as well. Also, too, we want to back off on, sitting down for a snack and eating, cheese and pepperoni before we go to bed, because once again, we're taking in a lot of unhealthy fats and highly processed items. So these items are not going to really benefit your body at all. Another question that came in is examples of some good snacks to eat after lunch and before dinner. Well, a good snack, a healthy snack, what we can do is look at healthy carbohydrates. For example, a small cup of yogurt, we can have that for a snack. A small piece of fruit, you can have that for a snack. Another thing that you can do is some people might like it, is measuring out a little bit of dry cereal, mixing it with nuts. That usually gets a nice combination, very crunchy. Those are examples of some snacks that we can have. Another snack, once again, is based on what your food preference is. If you enjoy hummus, you have a little bit of hummus, and you can use that as a dip for veggies such as, sweet peppers, tomatoes, even carrots. so we can incorporate that in. So those are some examples of snacks. Websites that are great resources. I always like to tell my patients check out the American Diabetes Association. For some reason, a lot of people just don't go there. So I do recommend that you check the American Diabetes Association and also too the American Heart Association. They're great websites that give you lots of great information. Easy to prepare recipes are going to be on there as well. Thank you.